Blood. Vehicular accidents, intrapersonal violence, falls, occupational physical therapy, home injuries, and recreational injuries all contribute to a loss of productive life worldwide, and all too often life itself completely. With the help of people who are able to make the conscious decision to donate blood, it could be your blood that is used to help many of these people who have been seriously injured, and it could be your blood that is used to help them. We are the new generation of donors, and without the help of many young adults today, there is an extremely low in blood shortage. Through extensive research and personal experiences of giving blood, I have learned how important it is to donate blood. After explaining the need for a sufficient blood supply, the donation process, and benefits of giving blood, I hope you will decide to save lives by donating. The need for blood never lets up because every day there are people who need donations in order to survive. The blood must go through a series of time-consuming tests and then be given to the patients before it perishes. Fresh blood is only good for about 42 days. As a result, maintaining an adequate blood supply is a challenge. Do not donate blood if you are unsure of the health of your blood. This is directed toward those of you who are unsure if they have transmittable diseases to protect others. It is better to give no blood at all than rather to spread disease to another individual. In the United States, it is known that roughly 97% of the population will need blood at some point in their lives. It's up to you, people like you and I, to ensure that they get the blood they so need. Everyone needs blood transfusions to replace the blood lost during surgeries, internal bleeding, and/or to treat diseases. According to American Blood Centers, of the 69 million children, hundreds of thousands suffer from forms of disease or illness that are born prematurely, suffer from blood disorders or cancers of the blood, and need transfusions to survive. Many of these children are now able to walk, skip, and live fully successful lives because they were given another chance because people like you and I contributed. This would not be possible without the generosity of volunteer blood donations. I want to inform you about the process of donating blood so you can begin doing so yourself. The Blood Center of America has provided several ways that we can go about doing this. First, you must be found eligible to donate. You have to be at least 17 years of age, have a weight of 100 pounds, and be of good health. If you feel your blood may be of high risk, you should not donate. If you meet these requirements, you can visit many of the blood centers or booths available on or near campus. You will first be asked a series of questions related to your individual medical history. If you pass the medical questionnaire, have an adequate iron level, blood pressure, temperature, and pulse are normal, then you can donate blood. A technician will clear your skin around the veins and use a needle to extract the blood. This process takes about roughly 7 to 10 minutes, and then you're free to go home knowing you just saved up to 3 lives. There should be no reason that hospitals do not have enough blood to give their patients. I read from Children's website that if 10% of all possible blood donors gave blood just once a year, there would never be a blood shortage problem. There are numerous benefits to giving blood. You will soon receive a card with your cholesterol level and the phrase, "Congratulations, you just saved up to 3 lives." There are also snacks and beverages available on site. A few questions. I took the time to answer some frequently asked questions. Many of you asked, doesn't it hurt? Don't I need my blood for a reason? I'm not sure if I'm willing to give it all away. You cannot hurt yourself by giving blood. Your blood replaces fluid within 24 hours and replaces red blood cells within 6 weeks. Are the needles really clean? According to American Blood Centers, trained medical technicians use only new, sterile, and disposable needles to draw blood. Now that you've heard both the problem and the solution, it's time to see it in action. All eligible donors with safe blood need to make an effort to donate. Obviously, we hope that we can encounter a situation that when we encounter a situation, we can someone we know needs blood. It will be available and disease-free. Imagine a scenario where your friend or loved one doesn't get the blood they so need and it costs them their life. Imagine if there is blood available but is contaminated and administered to your friend or loved one. Now imagine you or your friend or loved one survives in a tragic accident because safe blood was available and administered when needed. So I have explained to you that there is a definite need for increased blood supplies in our hospitals. Someone needs blood every 3 seconds. Donation process is simple and you receive the greatest benefit of all, saving lives. It is hard for us to imagine that you do not need to be a superhero or be in the right place at the right time to save a life. As for me, whenever I get the chance and often as I am qualified, I intend to donate blood and urge you all to do the same. All you have to do is sit back, relax, and eat snacks while you give a priceless gift. Thank you.